I am an oculoplastic surgeon. Oculoplastic surgery is a field of ophthalmology. Ophthalmology has different subspecialties, including cornea, glaucoma, anterior segment, uveitis, neuro-ophthalmology, and the one I do is called oculoplastics. So essentially what we do is we take care of patients with eyelid, orbital, and lacrimal problems. So everything surrounding the eyes. If you want to teach surgery, if you don't really see the surgery or you're not already a seasoned surgeon, it's hard to learn new technologies. With new technology available, like video streaming from the operating room, you can send that information anywhere in the world as long as they have a computer and internet access. And interestingly enough, as remote as places are now, most places can have a computer and internet access. So there's different ways to teach new technologies to physicians around the world. There are organizations that go and take surgeons there to teach locally, but this way you don't even have to leave your city. You can take the technology to multiple places in short notice. There's no substitute for being in the OR. So if people from other countries cannot travel to the United States, there's limitations in terms of like money, credentialing, and stuff like that. But if they can access the internet and they see you operating, and and the service nowadays can actually be streamed, the video can be streamed live. So they can ask you questions from a room in let's say Lima, Peru, and I am here doing the surgery and answering the surgeon's questions. So it's a very interactive way of learning, and for them visualizing at the same time and not just listening to the technology but actually seeing it, the surgery, it's a much better way to educate other surgeons around the world. Yeah, what Texas Institute for Surgery is doing with this technology, it's really incredible because a few years ago, not even that long ago, it was difficult to think that you can learn from other surgeons, from other doctors instantaneously. And nowadays, it's not that hard. I mean, can you believe that I can be presenting, I can do a live presentation in a meeting in South America, Europe, Asia, or Africa without even having to leave Dallas. And the meeting can be going on and they can broadcast a live surgery from here. And that way it enhances physician education